We're going to discuss about 5 drugs which are commonly used for nerve pain or neuropathic pain. The first 2 drugs are amitriptyline and nortriptyline. These 2 are similar in that they're tricyclic antidepressant. They act by inhibiting the serotonin and noradrenaline being taken up by the synapses. There's more serotonin and noradrenaline available, and that's the mechanism of action, how they inhibit the pain. The dosage is 10 to 25 mg once a day at night, and it is taken at night because the side effect is drowsiness. Tricyclic antidepressants as such have multiple side effects. They have a lot of anticholinergic effects, and they can cause urinary retention, constipation, drowsiness, and they can also cause falls in elderly patients. So how is amitriptyline different from nortriptyline? Amitriptyline is converted to nortriptyline in the body, and nortriptyline is the active form. And as such, nortriptyline has a better safety profile than amitriptyline. These drugs are preferred in patients who have neuropathic pain, and in addition to that, they have difficulty sleeping. That is, they have insomnia. Because the side effect of these drugs is sedation and drowsiness, and it works both ways. The next set of drugs are gabapentin and pregabalin. These 2 drugs are anti-epileptic drugs, that is, they're used for seizure medication. If you want to know more about them, check out my video on epilepsy. So these drugs inhibit the calcium channels and inhibit the progression of pain pathways. Here, pregabalin is different from gabapentin because it is a more active form and it has better safety profile, and it's faster acting compared to gabapentin. Gabapentin is usually given 3 times a day and pregabalin is given twice a day. And the dosage of gabapentin is starting from 100 mg given 3 times a day, and it can be up titrated. For pregabalin, the starting dose is 75 mg twice a day. The main side effect of gabapentin and pregabalin is that it can cause weight gain and fluid retention. But the advantage is that it can be used in renal failure patients because it can be dose titrated according to kidney functions. So when do we prefer these drugs? This is in patients who have neuropathic pain, and they also have an element of anxiety because these drugs helps in calming down the nerves. The next drug is duloxetine. Duloxetine inhibits the serotonin and noradrenaline to be reuptaked into the synapses. That is, it is SNRI inhibitor. Duloxetine is taken once a day and the starting dose is 30 mg. The advantage of duloxetine is that it has antidepressant effect. And for the dose, which is the starting dose of 30 mg given for the pain, it also displays antidepressant properties. The disadvantage of duloxetine is that it can cause a weight gain, and it is avoided in patients with chronic kidney disease. So when is duloxetine preferred? It is preferred in patients who have neuropathic pain and in specific diabetic neuropathy. In diabetic neuropathy, duloxetine is the first drug of choice, and it is also preferred in patients who have neuropathic pain and have an element of depression to it.